Today's chief complaint is a 13-year-old boy that sleeps for days at a time. His parents bring him into the office and they say that their son has been sleeping for days at a time. They say that he is sleeping for at least 18 to 20 hours every single day, and he only wakes up to use the bathroom and to eat. Not only that, but when he's awake, he's grumpy and he is mean. He is irritable, he doesn't want to talk to anyone, and when he eats, he kind of eats like a slob, kind of just putting things in his mouth to eat and get some nutrition. And right afterwards, he goes back to sleep. They say that when they try to keep him up, when he's not sleeping, he's just too drowsy. He just has such an urge to fall asleep and he'll go back to sleep. They say that this lasts for anywhere close to a week, usually 6 to 8 days at a time. But when he's not sleeping, when those episodes stop, he's a normal teenager. He's going to school, he's in the 8th grade, he's getting all A's. But during the periods where he's sleeping on days at a time, when they even try to wake him up for food, he's confused, he's groggy, and again, he's very mean. Usually he loves to play with his little sister, play video games with her, but when he is during these episodes, he doesn't even want to talk to her. So overall, his parents say that he sleeps for days at a time, usually anywhere from 6 to 8 days for each period of these episodes, and then in between them, he's normal. They first noticed the first episode about 6 months ago. It was right after he had a cold, he had a little bit of a fever, he had a cough, and afterwards he just slept. And they thought that, well, I guess he's getting over a cold. But then a few months later, it happened again. And after this third episode that happened, they decided to bring him in for further evaluation. The last episode ended 4 days ago, and his parents say that now he's back to baseline. So when someone tells me that their child is not waking up and they're not able to get their attention, and this is happening for days on end, one thing I'm very worried about are seizures. Even though they're not saying that the body is shaking, he could still be having non-convulsive seizures. When someone's having unidentified and uncontrollable seizures, I'm worried that there's too much activity in the brain. There's so much firing of the neurons or the brain cells going on in the brain that they're not able to control their actions. One thing that could happen is that the brain and the breathing centers could be affected and they might not even be able to breathe, which can lead to death. So I really need to understand what's going on and how we can stop it in case this is a seizure. Something else that this could be is that it could be a rare sleeping disorder. I'm not sure yet, so I need to do my exam to help with my localization. So on my exam, the things that I'm really looking for is his mental status. If he's having unidentified seizures, it might be harder for him to be able to follow commands and understand what I'm saying. On our exam in general, he has normal vital signs, they're all within normal limits. He does not appear uncomfortable. He's breathing comfortably on room air. And when I get to my mental status exam, he's actually alert, he's awake, and he's aware of the situation. He's able to tell me his name, the exact date, and he's able to tell me where he is right now, including the city, but even the floor of the building that he's in. I test him a little bit harder. I say, can you count backwards from 100 but subtract 7 each time? He's able to do those serial calculations well. Then I try to be a little bit more tricky. I say, can you spell world backwards? Does it perfectly. So overall, his mental status is really intact. He's able to follow complex commands, 3-step commands. He's understanding everything I'm saying. His name is intact. I'm not worried about his mental status. In fact, his entire neuro exam is completely normal. I do not find any focal deficits on the exam for me to be able to think about where I can localize this to in the brain. But I still have the history. His dad does say that right now he's not in an episode. So even though there's these concerning episodes in which he's sleeping for days at a time, right now they say he's back to his normal self. And typically this is what happens in between the episodes. Based on the story that he's sleeping for days at a time, I'm worried that this can localize to the sleep centers of the brain. There's a few sleep centers that I can think about. One of them is the hypothalamus, that controls the sleep-wake cycle. The other one is the thalamus, which is a really cool area of the brain that helps control relay center. They actually call it the relay center, where you're able to send communication throughout the entire brain through the thalamus. So I'm worried that maybe there could be a lesion in that area that could be explaining his symptoms. I'm still worried about seizures, even though right now in my exam room, he doesn't seem to be having an active seizure. So overall, based on his symptoms, there are a few things that I'm really worried about. I'm worried that this could be a seizure, an unrecognized seizure. If we don't control it, it could lead to death. I'm worried that maybe he has a tumor or a mass in the areas of the brain that control sleep, whether it's a hypothalamic tumor, a thalamic tumor, we're not sure. The other things that we can think about is that could this be some type of infection or inflammation? Does he have encephalitis? When we say encephalitis, what we're saying is that could there be inflammation of the entire brain that is causing him to have these symptoms as well? Other things that we can think about, he is a teenager, he's 13 years old, it's hard being a teenager. Could this be depression? But we really need to do a workup to understand what could be going on with him so that we can treat him and make sure that he has a good quality of life. So we get an MRI. I get an MRI brain with and without contrast, and his MRI is completely normal. I don't see a lesion or a mass anywhere within the brain. That's reassuring. We don't actually want to be able to tell a family that the kid has a tumor. The next thing that we do is an EEG. An EEG is what we use to look at brain activity and see if there's seizures. We put stickers on the scalp and we're able to record brain activity and see if there's any abnormal brain activity that could suggest a seizure or increase likelihood of having a seizure or a seizure disorder. When we do the EEG, his is completely normal when he's awake and when he's sleeping. The next thing that we do is a sleep study. Again, he is not having any symptoms right now, and when we do the sleep study, it's completely normal. That's not unexpected because he's not having the episode in which he's not sleeping. Overall, with the MRI, we ruled out any big scary tumor or mass, any intracranial process that could be explaining this. With the EEG, we've ruled out seizures, which is really great. And then we've also done a sleep study that's completely normal. So based on his constellation of symptoms of everything that his dad is telling us, I'm really worried that this could be a rare neurologic disease called Klein-Levin syndrome. And this is a hypersomnia syndrome, and some people even call it the Sleepy Beauty syndrome. And during this syndrome, patients sleep for days on end. They sleep for hours each day, and they only wake up to eat and to use the restroom. They can be more moody, more irritable, have more disinhibition, which basically means that they are doing things that they wouldn't normally do. And they could just sleep, and this can disrupt their entire function in life. We actually typically see this syndrome in adolescents. The thing about this syndrome is that there's no treatment. I can't go to his parents and say, here's a medication to treat his symptoms. All we can do is hope that he grows out of it. And most kids do grow out of it. By the end of their teenage years, they no longer have these episodes of extreme sleepiness. When they do have the symptoms, what we need to do is make sure that they're safe, that they're eating enough when they are awake, and then we also ask for school accommodations so that they're still able to function, have a good quality of life in between the periods where they're sleeping. So for him, when he was brought into the office by his dad when he was 13 years old, he had 3 episodes in the last year. Over time, those episodes did decrease in frequency. By the time he was 17 years old, he only had 1 episode in the last year. Likely he's going to grow out of these sleeping episodes and be able to have a great quality of life.